Welcome to a short paper review, providing a brief overview of new research conducted at the University of Nottingham School of Veterinary Medicine and Science, investigating antimicrobial usage on British dairy farms. Antibiotic resistance has regularly hit media headlines in recent years, and the government-commissioned O'Neill report has predicted that if left unchecked, AMR could be responsible for the deaths of around 10 million people per year by 2050. Unnecessary use of antibiotics has been linked with increased levels of antibiotic resistance, and whilst it's difficult to say whether this resistance is likely to be transmitted from animals to humans, one of the key recommendations of the O'Neill report was to reduce unnecessary use of antimicrobials in agriculture. In order to reduce unnecessary usage in the dairy industry, it is important to understand exactly where farms are using antibiotics and provide vets and farmers with the tools to identify high levels of use and assist with lowering antimicrobial usage levels. We collected data from a convenience sample of UK farms with dairy cattle only, looking at veterinary sales data from 4 veterinary practices, as well as investigating usage data recorded by farmers electronically at the time of treatment. Ultimately, our dataset consisted of 358 farms and over 80,000 cattle, which represents over 5% of British dairy cows. Our study aims to provide a benchmark figure for antimicrobial usage levels in UK dairy cattle and identify factors associated with high antimicrobial use. To allow comparison between different species of livestock, antimicrobial usage is sometimes measured as mg or milligrams of antibiotic used per kilogram of livestock on farm over the course of the year, the population correction unit. This figure is known as mg per PCU. When we benchmarked all of our 358 farms together, we can see that the vast majority of dairy farms are well below the 45 mg per PCU antimicrobial usage average across all livestock species in the UK, with a significant number below the 21 mg per PCU by 2020 target set specifically for dairy farms by the Rumour Targets Task Force. Whilst the majority of dairy farms exhibit relatively low levels of antimicrobial use, there exists a small population of outlying farms that exhibit high usage of antibiotics, with the highest 25% of farms contributing over 50% of total antimicrobial usage in this study. After identifying farms with high levels of antimicrobial usage, it is important to determine which factors make the largest impact to antibiotic usage. The use of either antibiotic foot bath products or oral antibiotic powders on farms significantly increased antimicrobial usage and highlight the effects of group treatment methods on antibiotic usage levels. To provide veterinarians and farmers with the tools to monitor antimicrobial usage, the University of Nottingham have created an antimicrobial usage calculator which calculates antimicrobial usage depending on which products we use and how many animals were present on the farm. This process can be performed for any UK dairy farm, providing insight into how antibiotics are used on each farm. To complement this calculator, the University of Nottingham have also created a benchmarking tool, and once antimicrobial usage has been calculated for each farm, the tool can import data from all farms and provide a benchmark to help identify high antimicrobial users. This benchmarking tool can then output various useful graphs to help analyse the antimicrobial usage levels in a variety of ways. This can aid in identifying high users, but also highlight farms using particularly high use practices, such as antibiotic foot baths. To ensure these tools are widely accessible, they've been made freely available on the AHDB website. In conclusion, this study has identified that whilst many dairy farms are relatively low users of antimicrobials, there exists a small population of high antimicrobial users, with the use of group treatments such as antibiotic foot baths and oral antibiotic powders significantly increasing usage. By using freely available tools, farm antibiotic usage can easily be calculated and benchmarked, therefore identifying the small number of farms using high levels of antibiotics. By identifying high-use farms and specifically reducing treatments such as antibiotic foot baths, a rapid and significant reduction in overall antimicrobial use is likely to be achieved. As always, a proactive herd health approach in conjunction with the farm's veterinarian will be key in reducing antimicrobial usage. The prevention of disease will result in an effective reduction in the number of antibiotic treatments necessary, alongside significant benefits to animal health and welfare. Thank you for watching this short paper review covering recent research from the University of Nottingham School of Veterinary Medicine and Science. For more information, please see the full paper published by the Veterinary Record.